A proposed town outside of the Bay Area struggling to get started. Now, two familiar faces hired to help move California Forever forward. The changes they want lawmakers to approve this month.
Why should Sacramento make a special concession for this project?
Bruce Willis's wife calling for change.
We want to be seen. We want to be counted.
The actor diagnosed with a rare type of dementia.
To learn that diagnosis essentially just vanished. It just disappeared.
How state leaders could help. Ensuring homes are protected in a disaster.
That's why I think we need an insurance commissioner who's ready on day one to get in there into deep negotiations with the industry on behalf of consumers.
How Ben Allen hopes to use his experience with the LA wildfires to fight for wildfire victims. A push for health clinics to spend most of their money on patient services. Why California voters are getting involved.
Thank you for joining us for California Politics 360. I'm Ashley Zavala. The backers of a new proposed town called California Forever have been struggling to get it started. Now, with just weeks left in California's lawmaking session, they're hoping to get some last-minute help from lawmakers and the governor to move it forward. California Forever wants lawmakers to carve the project out of some of the state's environmental requirements. They also want the ability for a neutral third party to step in if cities and counties can't agree on how to divide up the tax money. If these changes are made, supporters say it could attract a major business to the area to help with the development. If not, they warn this could be another cautionary tale for the ability to do business in California. Recently, California Forever hired two former state lawmakers to help them build clout at the Capitol and push the project forward. Those former senators, Democrats Bob Hertzberg and Darrell Steinberg, who is also the former mayor of Sacramento. Here's part of our conversation. There is a trust issue with California Forever that stems from the people who bought up that land. And not only that, this has no local voter approval. I mean, a ballot measure to get it approved was polled in 2024. So with that, why should Sacramento make a special concession for this project?
I'll let you knock that one out of the park.
Well, first of all, the history is real, and there has been a lack of trust, and in many ways it's understandable. And so do you look backwards and say, in a county that is really hurting, you look at its budget deficits, you look at the loss of a lot of its leading industries, do you look back and say, well, because of that, we're going to do nothing? Or do you make the developer, as they say, you don't trust, but you make them verify?
Right.
Do you say, we're going to give you a chance to get started, but we're only if you actually get a signed lease with a major shipbuilder or manufacturer. We will let you build housing and housing close by, but not the full city, just as much housing as is necessary for the employer. That's the choice here, and with very little risk or downside. And so we understand politics, and we also understand hard feelings. But then it seems to me that you have to learn from the past, but then think and act forward and do the right thing on behalf of the people who need jobs and who need workforce housing. So we have shrunk this in terms of our concept. The vision's still the vision, but we're saying let's take this in bite sizes. And I think it's reasonable, and I think it's an opportunity because we lost Saronic. It's not the end of the story, but it's a cautionary tale.
And can I say, the point you raise is also right about issues of water and all the sewage and electricity and all those things. They're absolutely legitimate. Those are within the power of local government. The county, through its development agreement, it says we'll make those decisions. We're just looking at a handful of a couple of the impediments that slow up the process at the state level and give the power to the local level to make all those decisions, to set up all the agreements they want. And also, they can say, you know what? We don't agree. Fine. We're just trying to plow the road to give an opportunity for this to happen.
Local control is maintained 100%.
100%.
Right.
And the vote happens too. We're leaving that in terms of the process of the vote of the people, and if there were to be an annexation under the Knox-Cortese-Hertzberg Act, we're leaving that in too.
Okay, you both have mentioned Saronic Technologies, and for those watching not familiar with that, that's a shipyard that essentially a business that just chose Texas over California,
Correct.
essentially. So just yes or no, were you surprised that they chose Texas?
I was disappointed.
Disappointed. I don't know if that's surprising.
But you weren't surprised,
we
or
were
were
worried
you?
about the time. They made it clear to us. We met with them. We met with their CEO. We've talked to all the various people. We knew that if we couldn't get this done, in fact, they were up against a time pressure because of their contracts with the Navy, and they had to perform in a short period of time. So we knew that if we didn't get legislation in place in a time, that there was probability that it was going to go to Texas.
But as I said, it's a cautionary tale. It's not the end of the story, it's the beginning. Because, as Bob said, there has been real interest from a dozen or more similar companies. We can't name them here, right? But that's the fact. And all we're saying is, give California an opportunity to win the next competition and the competition after that, not by waiving any of the laws, but by speeding up the permit process, allowing there to be a modicum of housing to support the jobs. And as Bob said, the annexation, which gets into complicated law, there's worry that somehow we would ask the legislature to take away the vote of the people. And we want to be very clear. The vote of the people will remain in any approach that we take. The only thing we want to do on that score is to say that when it comes to the negotiation between the city and county about tax sharing once land is annexed, that there needs to be a time limit, so it can't go on forever. And if they can't work it out, then there's a binding arbitration, modest change in the law in order to create the opportunity potentially for something great.
This conversation continues online. I ask Steinberg and Hertzberg if they take any responsibility for the hurdles California has now when it comes to building and attracting businesses to the state. In response to the proposed changes, concerned residents, leaders, and organizations sent a statement to Governor Newsom and legislative leaders asking them to shut down what California Forever is trying to do. They said, in part, advancing these proposals at the last minute would be extraordinarily harmful to Solano County communities and the environment, and we urge you to reject any such legislation. They continued to say the breadth and scope of what is being asked demands the kind of transparency and evaluation that can only be achieved through the full legislative process, end quote. We have the full statement online on calpolitics360.com. Bruce Willis's family pushing for more data on the rare type of dementia he was diagnosed with. The changes they're asking lawmakers to pass. There's a push at the state capitol to start tracking a rare type of dementia. This week, Bruce Willis's wife, Emma Hemming Willis, was at the state capitol pushing for legislation that faces a key vote this upcoming Thursday. Bruce Willis was diagnosed with frontotemporal dementia. It's a progressive brain disorder that changes thinking and behaviors. There's no cure and no treatment. Right now, the state has no way of tracking how many people have this type of dementia. The Willis family is advocating for legislation that would add frontotemporal dementia to the Neurodegenerative Disease Registry program. The program does track other neurodegenerative diseases like Alzheimer's and ALS. The future of this bill will be decided on Thursday as it faces a key vote from the Assembly Appropriations Committee. I sat down with Emma Hemming Willis this week. Here's part of our conversation. This proposal that you're advocating for, I mean, in the spirit of what's happened to your husband, what specifically are you hoping to accomplish?
Well, I think what was so shocking for me to learn was that when my husband Bruce was diagnosed here in the state of California, to learn that that diagnosis essentially just vanished. It just disappeared. So, I think what's so important about this bill is that we want to be seen, we want to be counted, and what we're asking is just that they add frontotemporal dementia onto the California Neurodegenerative Disease Registry that already exists.
How is your husband doing?
I think all things considering, FTD is a really unkind disease, but he is surrounded by so much love and support, and I think we're all doing the very best we can.
In the last 4 years, Can I ask what the evolution has been like in terms of, what really drove you to want to know more and to, get the state to learn and collect more data on all of this?
I think receiving that diagnosis and walking away with no treatment, no plan, no roadmap, I realized just how underserved this community is, and it felt like a really important opportunity to be able to, do something that's been very hard, but bring some, momentum and life into this diagnosis. Being able to be here today is so exciting for this community. It's so exciting for me. Like, I really do feel like we are moving forward, and having this rare disease be seen, we hope, is really the goal.
We talk more online. Emma Hemming-Willis there shares her message to other families who have a loved one with a neurodegenerative disease. Ensuring homes are protected in a disaster. Why Insurance Commissioner candidate Ben Allen wants the job. Ahead of the general election in November, I'm sitting down with the candidates running for major statewide offices. This week, we're focused on insurance commissioner. They regulate the state's insurance industry, everything from your car insurance, home insurance, and even life insurance. For the first time, California voters will decide between two Democrats to be the next insurance commissioner. That's between State Senator Ben Allen and Jane Kim. This week, I sat down with State Senator Allen, who explains how he would make an impact if elected. Sitting down with Ben Allen.
I've taken on big fights associated with protecting consumers.
The Los Angeles area wildfires last year pushed him to run to be the state's next insurance commissioner.
It was a terrible experience. It was right up the road from me. My mom, we had to evacuate her. I lived 1 block away from the evacuation warning zone with my 2 little kids. And I've spent so much of the last year trying to help this community rebuild and get back on its feet. And of course, a big part of this has been insurance problems. Lack of insurance, underinsurance, insurance nickel and diming people, refusing to pay out on time. And so much of my work over the last year and a half has been focused not only on the constituency service work, but also getting deep into insurance policy. I don't think I'd ever be running for this if it weren't for that experience.
Allen has been serving in the state Senate for more than a decade. He's been a lawmaker as California's homeowners insurance crisis worsened and as several insurance companies left the state. Could the legislature have done more to check the insurance commissioner? Do you wish, as a state senator, you could have stepped up more?
I think so. Quite frankly, the crisis it's only gotten bad. It's gotten discernibly bad in the last couple of years. It's not that the seeds weren't already planted, but it's really broken out in a major way over the last couple of years. And it's now as a result, a lot more people are focusing on this issue.
If elected, Allen says he'd take a series of actions on day one, including a kickstart of negotiations with the insurance industry.
I think we need more speed. We need to speed up the rate review process. We need to build out our customer service operation. It turns out, one thing I learned during the fires, there's only 34 people handling the incoming calls from working Californians every day. That's less than 1 per 1 million Californians. And we need to really ramp up that operation. I think we need to beef up the enforcement division. And then I think we got to get the ball rolling on a broader, on what's the next step to the sustainable insurance strategy that the current commissioner has put out there. How do we really work to incentivize all of this great work that's happening all over the state to reduce risk in a way that will be rewarded by insurance?
To address the homeowners insurance crisis, Allen says he would build on work current insurance commissioner Ricardo Lara started. As of last year, the state allows insurance companies to factor in the likelihood of a catastrophe and the cost of insuring themselves when setting rates. In exchange, the insurance companies need to provide coverage in higher wildfire risk areas. I want to know, what would you do differently than Ricardo Lara if you're elected?
Yeah, look, I think I'm someone who is going to be really focused on trying to make the system work for working people and for consumers. I'm not, I want to build on what he's done with the sustainable insurance strategy. I think it was a good start, but as has been reported on extensively in the press, It allowed for the insurance industry to get credit for writing policies in high-risk areas, but they were basically writing policies in the lower-risk parts of the high-risk zip codes. So we've got to tighten up the rules to make, but I think ultimately we're only going to be able to do it successfully as part of this broad negotiation that I've been talking about with regards to rewarding risk reduction around the state. So I think there's some good bones that are in place right now, but we got to go onto hyperdrive.
My full conversation with candidate for insurance commissioner Ben Allen is available right now on calpolitics360.com. Also this November, voters will decide whether to make certain health clinics spend the majority of their money on patient and services. Supporters say it will increase spending on patient care, while critics argue it will impact other key services. California voters in November will decide whether to require certain health centers to spend 90% of their money on patient services. Andrea Flores explains what would change under Proposition 44.
This November, California voters will consider Proposition 44, otherwise known as the Clinic Funding Accountability and Transparency Act. It's sponsored by SEIU United Healthcare Workers West.
We want to ensure that these community health clinics, which receive a large amount of taxpayer dollars, that they are spending the money on direct patient care and other mission-related services.
Prop 44 requires federally qualified health centers, or FQHCs, to spend 90% of their revenue on program services and report financial records. Community health clinics that don't meet that 90% would face penalties.
We already put patients first. Prop 44 is basically ridiculous. We're already doing our mission again at WellSpace Health is to achieve regional health through high quality comprehensive care, and we mean it.
WellSpace Chief Health Officer Dr. Janine Barra says its network of nonprofit community health clinics, and many like it, are already stretched thin after funding changes under the One Big Beautiful bill.
At WellSpace Health, we are not for profit, and this means that we don't have shareholders, and the majority of our board are actually our patients, and all of our money goes back into providing those vital services. Those services such as nursing managers, patient advocates, community health workers, things that really make the difference to helping people get to the right place to get their care.
Under Prop 44, administrative costs, management, and other non-program expenses would be limited to no more than 10% of revenue. SEIU UHW West spokesperson Renee Saldana says this proposition is meant to put patients first and keep clinics accountable.
What we've seen is that there are certain clinic systems that spend less than 60% of their total funding on things that aren't patient care. What we're seeing is oftentimes some of these community clinics are spending money on non-essentials like art collections, fundraisers where they lose money. And I think a lot of people would be surprised to know that many of these CEOs or other executives at these community health clinics that receive federal funding make millions of dollars a year.
We asked Dr. Barra how much WellSpace currently spends on patient care.
Being not-for-profit, 100%. Everything is needed in order to get people to where they need. Meaning, like, the patient advocate helps to make sure that the person knows where to get their services. And this proposition even has the ability to cut janitorial services. Why should my patients not be able to go to a health center that is clean?
Andrea Flores, California Politics 360.
If approved, Prop 44 would allow California's Attorney General to define which expenses ultimately qualify here. Penalties could be refunded if centers start following the law within 5 years, and centers could face criminal charges for false reports on spending. Right now on calpolitics360.com, you can watch this week's full interviews. We also want to hear from you. What issues do you want us to cover? Send us an email at contact@calpolitics360.com. Thank you for joining us for this week's California Politics 360. We'll see you next week.